I think Sarah is suffering from PTSD and likely depression, even though she denied depression. I think that the experience Sarah had when she was 8 years old, having soldiers burst into her home, threaten her father and them with guns while her mother and the children hid, fleeing and seeing people shot and killed, thinking that they would all be killed, I think that was a traumatic experience. I also think that for various reasons, she was not able to emotionally process it at the time. Even after her family immigrated to the United States, she says, we never talked about home or the war. Now remember, we think that 3 bits of information, stimuli, responses, and their meaning is important. There are many stimuli that trigger fear reactions and that Sarah avoids, including loud noises, crowds, talking about the traumatic event, and social contact in general. She avoids traveling during rush hour on public transportation, going to movies or any large events, and she fears for her family's safety when they're away from her. Sleep problems, as we've mentioned, are a common problem of PTSD, but for Sarah, sleep is particularly difficult, I think, because the soldiers burst into her house in Somalia at night, waking her up. So she feels very vulnerable while sleeping or trying to go to sleep. She is very fearful of police, both because it was soldiers who entered her home and threatened her family in Somalia, and because of the history of police brutality towards African Americans in the United States. Some of Sarah's responses include fear, exaggerated startle responses, her word is jittery, hypervigilance, decreased concentration that she described as feeling spaced out, nausea and lightheadedness when confronted with reminders. And remember, anytime I hear lightheadedness, I'm considering that the patient might be hyperventilating. She avoids talking about what happened in Somalia. She doesn't share it with others. She describes feeling lonely or emotionally numb that she describes as nothing, and is frequently tearful. She avoids talking to her siblings, fearing that they'll ask how she's doing or want to talk about what happened in Somalia. Other than going to work and taking care of her family, she is socially isolated. Sarah felt that they would all be killed that night in Somalia when she was 8, and anything that triggers that memory feels dangerous. And that's the meaning behind this. It feels dangerous. She feels vulnerable, and she feels that her family is vulnerable. So currently, crowds feel dangerous, particularly rush hour and public transportation. She feels trapped. She fears that her family is in danger as they go about her day, particularly her husband and sons, that they could be attacked or even killed by police, and for her daughter, fearing that she could be raped. She doesn't like to acknowledge her symptoms or difficulties because she thinks they're a sign of weakness and incompetence. So she didn't know about PTSD and really avoided coming into treatment and feels that it's all her fault and that she's just weak. Predisposition. Sarah's world was shattered when the soldiers entered and ransacked her house and threatened her family, and her mother hid the children. She never felt fully safe again. Seeing her father turn to alcohol afterwards caused her to be cautious of drinking. Her parents never talked about what happened, so she never had a chance to process the experience or even in training in how to talk about difficult topics and emotions. The perpetrators were the Somalian soldiers and a corrupt regime.